Associate Professor Dr. Tuğçe Şimşek. Today, we will have an interview based on the most frequently asked questions from our clients, our patients. Our friends will direct the questions from our patients to me. We will also provide a brief summary of the situation with concise answers. After nose job, there may be swelling and bruising around the eyes for up to 2 weeks following the rhinoplasty surgery. Of course, there is also swelling in our nose. After 2 weeks, the swelling and bruising around the eyes will disappear. It doesn't cause permanent damage. Considering this situation, the payments from patients are being received quite well within a period of 1 month. However, this edema decreases rapidly within 3 to 6 months. The shape of the nose settles completely within a year. However, the process of healing may require up to a maximum of 2 years in patients with thick skin. But after lying down, if open technique rhinoplasty is performed, or if any incision is made to equalize the nasal base, of course we have stitches there. We offer antibiotic creams and moisturizers for these stitches. Patients who use these products 2 or 3 times a day on average can prevent the formation of crusts and reduce the risk of infections. Actually, after the surgery, there are things that we recommend our patients to be careful about rather than imposing restrictions. They also need to consume a sufficient amount of water, and it is important for us to maintain a diet that is rich in protein. Both drinking plenty of water and consuming a protein-rich diet help patients to quickly get rid of their edema. Patients can eat, drink all post-op, no restrictions apply following the surgery. Now, with regards to activities, our patients are able to commence their regular walking and daily activities without exerting any effort right away after the surgery. However, if they are putting in effort and engaging in a strenuous workout, we initiate their program a month later. We suggest that mutual competitions, particularly in sports such as football and basketball, commence taking part in these activities approximately 2 to 3 months after the initial period. We suggest sleeping with the head elevated and approximately 30 degrees higher than the waist to enhance the recovery process, making it better and faster. Of course, lying on your back can be challenging for our patients. An increase in edema occurs in the direction they lie down during sleep. This also causes some slight asymmetrical improvements. Of course, symmetry is eventually achieved. However, our patients undergo a more rapid and efficient recovery process if the supine position and head elevated position are provided. This is a very broad topic, but to put it briefly, during the healing period, redness at the tip of the nose, at the suture sites, a foul-smelling discharge, or rather a discharge that is green in color, an inflamed discharge would make us think of potential complications that may arise. Or a swelling that will occur on the posterior aspect of the nasal cavity indicates that a complication has developed suddenly. When patients face such a situation, they must promptly consult their respective doctors. Now, this is actually somewhat connected to nutrition and also our relationship with the dietary supplements that we take. As we mentioned before, our patients will consume plenty of water and have a protein-based diet. Besides, they can consume diuretic fruits like pineapple juice to boost their urine output a bit. But we don't want them to consume these too much. In addition, we recommend cream treatments, edema and bruise quick reducers, and medications that our patients can take according to their condition, medically. After the surgery, we take off the casts and dressings of our patients during the first week. After the purchase, we perform the first checks in the first month. Then we call our patient for follow-ups in the 3rd month, 6th month, and 1st year. However, a few of our patients may occasionally have different complaints in relation to this, or may have certain concerns. Then we have patients that we observe in earlier time periods. After the surgery, we have a cast on our nose for a week. We are purchasing this plaster. Following that, I create another cast in my own schedule that the patient is able to remove. We can take it, and after the first week, the patient can remove it at home. I do not recommend applying too many plasters afterwards. However, for patients with thick skin or if I have performed an ethnic nose, I recommend applying tape intermittently for up to a month. Thank you very much.